Alright guys and girls, it's jerninhgam here. Hope you're all doing well today. We're going to be doing a video. Hospitals in England record the biggest rise in admissions from months. BBC News, UK.
We start with the latest debate on the measures in place to slow down the spread of coronavirus. Council leaders and regional mayors in some of England's biggest cities, including Leeds, Liverpool, Newcastle and Manchester, where new cases are rising sharply, have written to ministers warning that the current set of restrictions is not working. And they are especially critical of the 10 p.m. rule for pubs.
I mean, I'm not surprised no one listens to the rules
In
anyway.
hospitals across England, they have recorded the biggest rise in admissions in a single day since the month of June. Well, new cases of the virus in the north of England have continued to rise despite the local lockdown restrictions that are imposed on millions of people, but cases in the south of England are relatively low in comparison. Our correspondent Dan Johnson reports now from Greater Manchester.
In the student streets of Fallowfield, the mood is darkening. There's growing concern here as case numbers rise, and there's more confusion as the layers of rules are built on. Ian's lived here his whole life.
It needs to either be in lockdown or not in lockdown. We're neither masked up, not masked up, one or the other, not half-baked. Bit of this, 6 of one, half a dozen of the other, and basically nothing.
All local people that have lived local said, oh God, when students come back, this is what's going to happen.
We've got a second influx of it. I think we should go back to being proper lockdown again.
But leaders of the worst affected cities say they don't want another lockdown. Their letter makes clear they think the existing restrictions aren't working, are confusing and counterproductive, and they've called for more shared decision making.
We're facing the worst of both worlds here. The infection rate's going up, the economy of our city's tanking. So we decided to come together and just really to stress to government the message we've been putting across so many times. Work with us locally.
On our floor, I think 7 or 8 people got tested, all who were positive.
The University of Manchester's seen more than 1,000 cases. Adam and his flatmates have been isolating for 10 days.
What on earth did they expect us to all do? Honestly, we're all young, we want to have fun. We've had a pretty poor 6 months. What does they expect? Yeah.
We also, a lot of us didn't have a choice. So we're all kind of put in this accommodation and we were all going to get it in the end.
We now need to introduce a contained approach with the universities just to manage transmission over the next 3 weeks and then take additional measures if necessary.
The council's been delivering letters to residents saying that the return of university students has had an expected impact on the R number here, and the relief
People knew it was going to happen. They were going to get the coronavirus in universities anyway.
It's just too easy, too simple to blame students when there are other things going on.
I feel like they have been duped, and we have been duped too. We all share the laundrette, the supermarkets, public transport. Inevitably, it will hit communities like ours, and we do have a higher number of vulnerable people, both socially deprived and people from the BAME community and elderly people as well.
Soul destroying for us to see people leave here at 10 o'clock, go to the local shop, buy a load of booze, and then go to a house party.
Ben's built his bar business here based on student trade.
We're down 60% on our revenue, and for me, the government either needs to shut us completely and give us full support, or they need to let us trade. If it carries on the way it is, we're not going to survive.
The government says it's working hand in hand with local leaders, ramping up test and trace and supporting those in isolation. It's important to say, not everywhere with students has problems, and not everywhere with problems has students. But here, the universities have announced they're moving most courses online to try to suppress the virus, and other big cities are braced for their own case numbers to rise. Dan Johnson, BBC News, Manchester.
And as we've been reporting, the rate of coronavirus infections in the UK has almost doubled in a week. Our medical editor Fergus Walsh has been considering the various factors which could be driving the new increase.
There is a north-south divide with COVID. Cases and hospital admissions have been rising sharply in cities in the north of England, where much of the population faces extra restrictions, while they're substantially lower in the south. If we look at 3 hotspots for COVID in the north of England, Manchester had 529 cases per 100,000 population, Liverpool 487 and Newcastle 435. Now contrast that with three cities in the south. Bristol had 46 cases per 100,000 population, Norwich 32 and London 60. What about those who are getting COVID? In the northwest of England, as in other areas, the highest rates are among people in their 20s. You can see how sharply it's risen in recent weeks. In more vulnerable age groups, people in their 60s, it's risen there too, as it has among people in their 70s and among the 80 plus. By contrast, in the south of England, COVID cases haven't yet started to rise much in older age groups, except in London. All that is reflected in daily hospital admissions. On the 3rd of October, there were 130 COVID patients admitted to hospitals in the northwest, 117 in the northeast and Yorkshire, but only 10 in the southwest, 19 in the east of England, and 38 in London. Every day, 1.5 million people use this COVID symptoms app from King's College London. It's shown there are consistently 5 times as many cases in the north of England compared to the south. And there are several possible explanations for this.
You've got the deprivation of the population, and definitely we do see twice the rates of infection in deprived areas according to our maps. Then I think you've got people not working as much at home in the north compared to the south.
Daily COVID deaths were more than 10 times higher at the peak in April, but the concern is that unless coronavirus cases are brought under control in the north, hospital admissions and eventually deaths will just keep rising. Fergus Walsh, BBC News.
Time for our look at the latest official government data on coronavirus. And it shows that there were 14,542 new infections recorded in the latest 24-hour period. And that means the average number of new cases reported per day in the past week is 11,994. Hospital admissions, as I mentioned earlier, jumped significantly on Sunday. On average, 470 people were being admitted every day over the past week. That number does not include Scotland. 76 deaths were reported of people who died within 28 days of a positive COVID test. And that means on average in the past week, 53 deaths were announced every day. And that takes the total number of deaths so far across the UK to 42,445. I'd like to talk a little more about the figures on hospital admissions, and our health correspondent Sophie Hutchinson is with me. What light can you shed on that?
Well, counting the number of people admitted to hospital with COVID-19 is one of the most reliable measures we have of how this pandemic is developing. Today's figures are concerning. Until now, hospital admissions had been doubling on average every 2 weeks. But if you look at today, the latest figures that we have, they show a sharp jump, a doubling in just about a week. The figures from last Sunday, as you were saying, 478 people admitted with COVID-19 compared to 241 the week before. It's also worth noting that Wales has seen a sharp rise as well. So far, neither of these rises in England or in Wales has translated into a sharp rise in deaths. But we do know there's usually a lag of about 2 weeks before death rates are impacted. Where are these hospital admissions? Well, they're in areas where we've seen the infection surge in the northeast, the northwest, and in Yorkshire. And now infections seem to be taking off in Nottingham as well. The rate has increased from 71 per 100,000 people to 440 per 100,000 people in just a few weeks. And health officials there are expecting more restrictions.
Sophie, many thanks again for the update. Sophie Hutchinson, therefore.
Well, it goes to show, guys and girls, that the infections are getting worse. Will they ever stop? I mean, China had the right idea to lock everywhere down, but the UK and America not so good. I mean, us British people don't listen. But anyway, thanks for joining me. Hope you all enjoyed the video. I'll see you in the next video. Peace.